Hello, Namaskar, good afternoon, sirs. Thank you so much for joining. Really privileged to have you on board. Thank you.
Hi, Shuchin. Hi, Dr. Karan.
Hello.
Hi, Dr.
Pranshu. Hello, Dr. Shuchin. Good afternoon, sir.
Sir, how are you?
Good afternoon to everybody. Good afternoon.
Good afternoon, everyone, and a very warm welcome to our webinar, Rethinking E-Waste in Indian Healthcare. If you think about it, hospitals are designed to save lives. The monitors that guided critical surgeries, the diagnostic machines that once gave life-changing answers, the IT systems that kept care running, all eventually have an end of life. And when we don't manage their disposal responsibly, we create a new health hazard. I'm Dr. Vanna Chawla, Vice President Academics and Research at Ujala Cygnus Healthcare. It is my pleasure to lead today's session. To commence this journey, I'm honored to welcome our distinguished speakers, Dr. Randeep, Guleria, former Director, All India Institute of Medical Sciences, New Delhi, and Chairman of Internal Medicine, Respiratory and Sleep Medicine at Medanta, Dr. Shuchin Bajaj, Founder and Director of Ujala Cygnus, Mr. Pranshu Singhal, Founder Director, Karo, Sambhav, and Dr. Karan Thakur, Group Vice President, Corporate Affairs and Sustainability at Apollo Hospitals Group, along with all the audience. Today we come together to explore a bold idea, circularity in healthcare. Not just discarding, but rethinking design, usage, and disposal. Not just managing waste, but creating value from it. And to set the stage for this important conversation, I'm delighted to invite a leader who has championed both quality healthcare and sustainability, Dr. Shuchin Bajaj, Founder Director of Ujala Cygnus Healthcare. Over to you, Dr. Bajaj.
Thank you very much, Dr. Vanna, for definitely for organizing this wonderful topic, and more importantly for gathering such a luminous panel of speakers who are like trailblazers in their own fields and as well as sustainability in healthcare. And it is really my privilege to give the welcoming note in such an important panel on healthcare sustainability and e-waste management with Guleria sir here, who's a living legend in the field of medicine and sustainability in healthcare, and shamelessly plugging as General Secretary of the Chevening Alumni India, my two Chevening fellows here, Pranshu and Dr. Karan, who are, we call ourselves as the living bridge, and all Chevening fellows are considered to be the living bridge between great civilizations. And now I think we will also be actors in this most important topic of sustainability. At Ujala Cygnus, we have always believed that delivering quality healthcare goes beyond treating patients. It is also about caring for the communities we serve and the planet we live on. And most people do not realize how much waste healthcare generates. And in an increasingly technology-driven sector, e-waste is becoming one of our fastest growing environmental challenges. From outdated diagnostic equipment to everyday electronics, if we don't manage all these responsibly, we will risk harming the very health that we are trying to protect. So today's session is not just about discussing the problem, it is about sharing solutions, creating accountability, and inspiring collective action. And we are really proud to partner with the like-minded individuals and like-minded organizations to ensure that our hospitals are leading by example, recycling responsibly, adopting circular economy principles, and making sustainability a core part of our healthcare delivery. And I would like to really reiterate that this is not merely a compliance exercise. It is a moral obligation for all of us. When we take steps to reduce our environmental footprint, we are actually preventing disease before it happens, protecting the air that our patients breathe, the water they drink, and the future that our children will inherit. So I'm really looking forward to hearing from our distinguished speakers today, learning from their insights, exploring how we can scale these practices across the healthcare ecosystem, and ensuring that together we ensure that healing people does not come at the cost of harming the planet. So really thank you very much for being here, and hoping that today's discussion will be a catalyst for real change in our ecosystems.
Thank you, Dr. Bajaj, for giving us that powerful context, reminding us that sustainability is not just a compliance checkbox, but a responsibility towards future generations. Our guest of honor today needs no introduction. He has been at the helm of national health leadership, guiding the country through some of its toughest health challenges, and continues to set the bar for excellence in patient care. Please join me in welcoming Dr. Randeep Guleria, the former director of AIIMS New Delhi and the chairman of internal medicine as well as respiratory and sleep medicine at Medanta. Dr. Guleria was honored with the prestigious Padma Award in 2015 for his contributions to the field of medicine. He has also received the distinguished Dr. B.C. Roy National Award for Eminent Medical Person in 2014, as well as the Lung India Award for the Best Original Article in Lung India from the Indian Chest Society in the same year. Today, he will share his insights on how healthcare's environment footprint, particularly e-waste, impacts our most vulnerable populations and the urgent need to bridge the gap between policy and practice. To you, sir.
Thank you very much for your kind words. And at the onset, let me thank the Ujala Cygnus group for actually inviting me to this very important issue, which very often is not highlighted as much as it should be. And I think in general, e-waste is something that we need to talk more about. But in healthcare, it's something that is not really discussed that much. If you look at how we are sort of progressing, then it's important to understand that we are living through a revolution. Some people call it the fourth industrial revolution. And we see so much change that happens both in health sector, but also overall in our lives. And one of this change, or in the health sector, this change is driven predominantly by two factors. One is technology, and the other is the pharmacology that is there. New pharmacological drugs come every day. We have new technologies available. We saw that during COVID. But I think the other important issue is the rapid advances that has happened in technology. The technology has moved into healthcare in such a dramatic way that we have moved from an era of clinical medicine to more of an era of investigative medicine, where we see more and more equipment being used, and we're having a lot of what we call state-of-the-art equipment in most hospitals, which is basically crucial for providing cutting-edge care as far as patients are concerned, better diagnostics, better care of patients, better monitoring. But when we look at all of that, this is also associated with more waste, and especially e-waste as far as the healthcare sector is concerned. Things change very rapidly. We keep seeing every year new equipment coming in because the old one rapidly gets outdated. New technology comes in, whether it be computers, whether it be monitors, or whether it be MRI machine, CT scan machine, PET scan machines. There is something new happening as far as the technology is concerned, and all hospitals, especially corporate hospitals, are sort of vying with each other to get the latest equipment, and that leads to generation of a lot of e-waste in hospitals. As a matter of fact, if you look at data, in 2024, there were over 347 million metric tons of recycled e-waste on this earth. That's a huge amount. And less than 17% of this waste was collected and properly recycled. Majority of this waste was not actually recycled properly. I would say more than 80% of it was actually not even recycled properly. And this is something which is even much more as far as the health sector is concerned, whether it be computers, monitors, CT scan, MRI machines, nuclear medicine equipment, or so many other equipments which are part of e-waste. It's important for us to understand that this leads to very toxic products being released both in the soil and water. It could be lead, mercury, cadmium, and this actually leads to a number of health-related issues. And as was said by Dr. Shuchin Bajaj, that we may be causing more health-related issues by this exposure than actually providing more care to our patients. Respiratory issues, inhalation of these toxic material can lead to significant lung damage. There can be neurological issues. We have enough data to show exposure to lead and mercury can lead to significant neurological damage, especially the newborns and the young children. And there are studies which show that even if you look at the cord blood of pregnant women or the newborn, there is higher amounts of lead which is being found in newborn babies. Kidney damage can also occur because of exposure to cadmium. And these are all part of the e-waste that we see. And therefore, there is a need to develop strategies for looking at how do we properly dispose e-waste. There's also the whole issue of data breach, which also comes in because a lot of the computers and electronic equipment which gets taken out sometimes done without making sure that the data is removed, and the data breach and privacy breach can happen. And that becomes more and more important in the current era, where patient privacy and data is so important. If you look at e-waste, a lot of e-waste gets dumped in the developing countries. And there is lack of proper regulations, there's no policy, there's even lack of awareness as far as this is concerned. Many years ago, I was involved with a group of which was looking at the health of rag pickers, a group called Chintan, and we used to do a health assessment of rag pickers who would go to these areas where they would try and segregate the waste and try and then collect it and see whether they could sell it to various groups. And they had so many health-related issues, which is because the e-waste, or the waste that was there, this was not only e-waste, this was general waste, had such a lot of toxic materials that it was affecting their health in many ways, and this was a major cause of concern. I think, therefore, as we've said, that there is a huge issue of proper utilization of e-waste, and in the current global scenario, it becomes important of looking at what is known as circular economy, trying to see how we can decrease the carbon footprint and the waste footprint as far as the earth is concerned. How can we recycle our stuff so that it goes back into where it's being used, and the exposure as far as the is concerned becomes less and less. But to do this, it's important to promote and develop proper strategies for recycling e-waste. I think it's important to develop proper policy for how do you destroy e-waste. I don't think we have that much in our country. We need to educate people. That's not only general people, but I think even doctors and policymakers and people in hospital administration of the importance of proper e-waste disposal. Probably look at how we can develop what I would say is collection point, and have an audit in each hospital. Are they really looking at the e-waste disposal in their hospital in a proper manner? Unless we really start addressing this problem, both at a micro level and at a macro level, I don't think we will be able to find a sustainable solution as far as disposal of e-waste is concerned in the health sector, because most people try and sort of look at the easy way out, and sometimes that can cause more harm than good in the long run. So I would once again really try and congratulate you for this good meeting, and I hope we can come out with some sort of a document where we can push for policymakers both in the hospital setting and in the government setting to really come out with some sustainable strategies, both in terms of education, in terms of developing proper collection areas, and in terms of hospital having an audit policy to see that they're disposing their e-waste in a proper manner. Thank you very much for inviting me, and I really would like to congratulate the organizers once again for this wonderful seminar that they're having. Thank you very much.
Thank you so much, sir, for taking out time from your busy schedule. I know hundreds of patients are still waiting for the consultation with you in the OPD area. Thank you so much, sir, for devoting your time for this and highlighting that this is not just an environmental problem, it's a public health problem. We do agree to this. To help us decode the concept of circularity in the healthcare context, we turn to someone who has been building the very systems that make it possible. He has worked at the intersection of industry, policy, and innovation, creating scalable models of waste management in India. I welcome Mr. Pranshu Singhal, the founder of Karo, Sambhav, to guide us on how, from life cycle approaches to hospital-level systems that can transform e-waste from a challenge into an opportunity. Over to you, Mr. Pranshu.
Thank you, Dr. Vandana. Dr. Guleria, thank you for giving a very, very powerful note at the start. And most importantly, highlighting the deep challenges that we are talking. I mean, and these challenges are not just at an organization level, they are deeply penetrating our society, because today electronics are part of our daily lives. Now, in healthcare, if I were to just focus a bit on healthcare used to be very small on the electronic side, just relatively 4 or 5 years back. But with the advent of, in post-COVID, if we look at, the consumption of electronics, both at a personal level, because people want to accumulate devices, they want to monitor themselves in so many more ways. What we are seeing is a a global growth, significant growth in the sales of medical devices, especially small equipments. I'm not talking large hospital equipments, but I'm talking really small, equipments that people have at their homes. And this is very difficult to recycle because, first of all, it's very tiny, has a tiny battery somewhere hidden, has many critical raw materials which are very difficult to recycle. And we need to really find ways to solve it. Now, if I were to really think of hospitals as an institution in itself, how does hospital community solve this problem at scale? The first thing for me is, design of the equipment, where hospitals don't have a say, but they have a very large influence on the organizations who are selling these products. Whether it's, I won't name any of the brands, but any of the brands, when we talk to them that you should design your products better, think of recycled content, think modularity in products, which means you don't have to change the whole machine, but you can just exchange certain parts. The whole thing is, no, my customer is not asking for it, so why should I? So one of the biggest changes I think that hospital groups, especially big groups like the ones present here, they can do is come up with some tough requirements on environmental side. What kind of equipments do I need? What kind of recycled content? And these guidelines are today available, fairly easily at a global level. And recycled content is becoming a norm, at least outside India. In India, we are still not seeing that amount of recycled content in products. But if one or two group, even start putting a basic voluntary guideline on this, I'm not saying even a mandatory, at least it sets the tone right, that every manufacturer, they start thinking, okay, now this demand is starting to come, maybe 3 years down the line, 5 years down the line, we will see a better equipment out there. A second part, when we talk of circular economy, is how do you collect products which have been sold? And that's a massive problem. The first is people don't trust the collection channels, क्योंकि like Dr. Guleria said, मेरा data चोरी हो जाएगा, मुझे नहीं पता इसका क्या होगा, and we have all suffered things like, we have seen open air burning of fires, we would have seen, e-waste कोई साइड में कहीं तोड़ रहा है, उसमें से कुछ कॉपर निकाल लिया, एल्युमिनियम निकाल लिया, बाकी फेंक दिया. मतलब all of these things are very commonplace in our daily lives. So unless we find a way that how do we build trust amongst people, and that's where I think hospitals as a group, as a sector in itself, can be a game changer, because once the hospitals start talking about this subject, start, giving some touch points, that this is an important topic, and it could be very innovative in itself. You can come and drop your devices, at some of the places designated, but some dialogue, because it's a very trusted space, that hospitals create. So we can even leverage that for creating large-scale collection systems. On the recycling side, again, very little infrastructure does exist. So some infrastructure does exist, but it's still very poor quality, I would say. We are still starting to see, some maturity in quality of recycling. But what is important from a hospital side is how do we select who are we going to work with? And yes, they may not be perfect for now, but is there a roadmap on how my partner is going to improve over a period of time? And is there a linkage? What we are even trying to see is in many spaces, like in glass, which is relatively easier product, there can be a direct linkage between the organization who sells you the product and your recycler. So are they providing the materials? Is there a loop closure in some form, at the back end? So those sort of things, again, can be designed. They will take time. I'm not saying it will happen tomorrow, but things that can be considered. Lastly, I don't know how much reuse potential exists in the sector, because you don't want to risk a patient, healthcare in any which way, because reuse may have certain technical challenges. But again, there could be harmonized standards by which one can define how and when do we allow for reuse in devices, in components. I don't think those sort of standards do exist, not just in India, even at a global level. So these are just some of the thoughts to initiate the conversation. And Dr. Vandana, I'll come back as we go ahead. Thank you.
Thank you, Mr. Pranshu, and for taking us through. And now I would like to request Dr. Karan Thakur to share his perspective and let us know at a scale and how we can incorporate this in policy, leadership, in partnerships, and how we can come together to make sustainability part of the healthcare DNA. Over to you, Dr.
Thank you, Dr. Vandana. Thank you, Dr. Shuchin, for the invite. And it's a pleasure and an honor to be here and to be to look at my fellow panelists. I never thought that I would be sharing the e-dais with them, so it's an incredibly proud moment for me as well. I think the previous speakers have really laid out the issue at hand extensively. I will not repeat some of the issues that were raised, but just to highlight one or two things that have changed the trend and the need for looking at e-waste and waste more generally. One is that we have seen a rise of digitization, which was very rightly pointed out, which is now leading to more and more electronification of records, whether it is generation of medical records and right down to things like imaging and also digitization of diagnostics itself. So the footprint of our e-waste therefore will also increase. Second is, we have entered an era post-COVID where reuse, as Dr. Pranshu said, has taken a back seat, and single use has become the norm of the day, whether it is e-waste and more generally speaking, consumables and waste as a whole. And how do we actually go back to our learned behaviors pre-COVID status quo ante, where reuse, sterilization, and those things were not just the norm, but things that were more prudent because they have an impact on environmental stewardship as well. Third is, as we expand our outreach to do screening, whether it is at the corporate setting or population level, screenings, we are generating a massive amount of biomedical waste and also concomitant e-waste. And that component has not really been taken into account. Fourth is the rise of home care. This is again a black box today. We are seeing double-digit growth, CAGR growth in home care, and there again we are generating a lot of biomedical waste and also e-waste, which is currently being unaccounted for. So while we look at more formal structures of caregiving like hospitals and clinics where it can still be accounted for, and there also we are doing a slightly poor job, I would say, of not really knowing the dimension of the problem, we also have newer modes of delivery of care which are also generating new types of challenges for us. And lastly, as Dr. Pranshu mentioned, wearables is the next level where we are seeing people at every season changing their wearables, whether it is smartwatches or other types of clinical grade wearables, and what happens to that channel of disposal, which should also be something which falls into the purview of doctors and the healthcare fraternity. Because if a cardiologist, for example, recommends a wearable for their patients, then they should also be passing on information on safe disposal of that wearable, because end of the day it may not be biomedical waste or hospital generated e-waste, but we are contributing to that larger problem in keeping a patient healthy. But as we do that, I just want to spend a couple of minutes to round up this discussion on why this topic is important in healthcare to begin with. Environmental stewardship, under whose gamut waste generation and e-waste form a part, is not just a problem which is a good to do. Today, the health sector generates close to about 3 gigatons of carbon dioxide emissions, which makes us the 5th largest emitter if we were a country as a whole. So the footprint of the health sector on the climate crisis and environment is quite significant. In fact, it's larger than shipping. And when you imagine shipping, you would think that it would be a big polluter, but the health, the health sector globally is even bigger than that. Having said that, the per capita contribution, when you look at India, still remains small when you compare to larger economies of the West. But at the same time, we know that India needs to add another 1 million beds over the next 3 to 4 decades. And once that increase in beds happen, we don't have the luxury of growing the way the Western health systems have grown. We would need to drive a more green approach towards our growth, sustainable growth. And again, that brings into the dimension of e-waste. And while we discuss 3 very important aspects of sustainability, primarily adaptation, mitigation, and resilience building of our health systems, circularity somehow does not get equal say. Whereas this is the 4th important pillar of anything that we do. Today, I think one recommendation would be that we look at circularity more holistically, reuse, reduce, and recycling are part of circularity. Whether they close the loop or are an initial step to closing the loop, it's very important to consider all three of those R's as part of the circularity domain. We at Apollo Hospitals in 2021, when we launched our program on sustainability called the Apollo Sustainability Action Program, ASAP, e-waste was a large part of it. But before we wanted to do that, we looked at the GDP of sustainability, as it were. The G and D and P are very important. The first is governance. If we don't have governance right from the top to that ward level leadership, where you have the nurse in charge, the doctor on rounds, the housekeeping supervisor, right down to that level, if they're not aware of the importance of waste management, of reducing the amount of waste being generated, and again, this is generic but also related to e-waste, without that governance structure, we really cannot put our arms around this problem. D is data. I think without data and good measurable data of how much waste you are generating, whether it is holistically for the hospital or a per bed or a per ward type of calculation or a per patient calculation, then we really don't know how well we are progressing. So while we say it's important to reduce our overall waste generation, how much is being produced? So I would strongly urge a good inventory keeping of how much waste is being generated. We do that very well in the corporate hospitals for biomedical waste, but this needs to expand to all sorts of waste that we must look at. And P are really programs that become projects at the ward level, at the unit level, or at the aggregate systemic level that we implement. So the GDP is very important when we look at waste. If you look at the Apollo hospitals through this approach, we've been able to increase recycling of e-waste by about 7% year on year. It may seem like a small number, but if you consider the amount of waste that we generate, close to about 90 metric tons of waste is generated across the Apollo hospitals group. This is a significant chunk of reduction that we are managing to do year on year. How is this possible? One is that we have formal partnerships. I think that was one area that was not previously touched upon. For example, we have tied up with Lenovo, which does a lot of our systemic buyback of the waste that we generate on the e-waste side. Similarly, partnerships with e-waste, the people who are recycling and disposing the waste is something that we have gotten into across the enterprise. So partnerships is a very important aspect of a reduction plan. But most important would be, do not use something if it is not required. Obviously, it should not impinge on patient care, but something that need not be required to begin with is the best way of reducing any type of waste to begin with. And we have put in targets for generation per occupied bed, and we are seeing year on year some reductions there. So we are hopeful that as more consciousness and awareness builds across our healthcare workforce, this number will come down. And just some of the suggestions before I hand it back to Dr. Vandana. I think if the health sector can do some demand aggregation, where smaller hospitals also come together and tell e-waste recyclers that, look, as a standalone entity, I may be producing just X, but when 10 of us come together, this is 10X. It's a scale that might interest you. That is something that is maybe of interest. The second is, I think we need reforms on e-waste, especially for the health sector, because sometimes our e-waste is also categorized as biomedical waste. Whereas if we have a delineation of biomedical waste and e-waste separate, we can then channelize that e-waste better rather than it going into incineration. Third is, there has been talk about right to repair. Currently, not many OEMs are actually, agreeing to doing a right to repair. They much rather replace, as Dr. Pranshu had mentioned. If that sort of demand is generated from the health system, we are confident that right to repair can help reduce both the operating costs of hospitals, but also reduce the amount of replacement of medical equipment. And I think the other advice and reform that could come in is that India currently does not allow import of second-hand medical equipment, and for various good reasons. But if there is a good architecture that is put in which protects patients and our domestic industry, then some of these medical equipment which are actually in very good condition can be made available at an affordable, sustainable price to hospitals of various size and tiers, and then can be reused, thereby increasing the longevity of this medical equipment and thereby reducing the e-waste. So I'll just pause there. Happy to take questions, and thank you once again for having me.
Thank you, Dr. Thakur, for showing us that green healthcare is not just an aspiration; it's possible when leadership commits. Thank you for bringing both vision and operational know-how to the table. It's now time to bring our speakers together for an open conversation. In this panel, we will explore questions from our audience. I'll begin with some questions directed to our distinguished speakers. I encourage all participants to start sharing their questions in the chat. Rest assured, we will include your voices in the discussion. Here's a question for you, Dr. Guleria. Given your experience during high-pressure situations like the pandemic, how can hospitals ensure e-waste protocols are followed even in the crisis times?
So I think if you have systems in place, then that is something that can easily be done, irrespective of crisis or whether there is no crisis. It's very important to two things. One is to have systems in place, and second is to be aware about how you can manage things. So have a plan in place for any crisis, whether it be an outbreak, whether it be any other crisis which happens. There should be some sort of pre-planning which is done, which would actually help in making sure that you have everything in place and you don't really go into some sort of panic mode when such a situation happens. Secondly, I think it's important to plan in advance for such things. And when it comes to e-waste, sometimes what happens is that and that's happened during the pandemic, more out of fear of infection, a lot of things happened which led to a lot of production of e-waste. Things got disposed, a lot of plastics could be recycled. We did a project where we looked at PPEs being recycled. There was a whole issue of shortage of PPEs, and we showed, and this was actually published in a WHO bulletin also, approved by WHO, that you can even, if the PPE is not soiled, personal protection equipment is not soiled, you can actually sterilize it and recycle it, and you'd save a lot of plastic waste. But it was the type of wastage that we had in terms of plastics and PPEs was phenomenal during the pandemic. So I think if you are able to look at it in a more strategic manner and have systems in place, it should be possible.
Thank you so much, sir, for your inputs. And what advice would you give to a 100-bed hospital in a tier 2 city that wants to begin its sustainability journey? Over to you, sir.
I think Dr. Bajaj would be better suited for giving an answer to this rather than me. He would have a bigger experience in giving this advice. But I think the issue would be to start from the very beginning in terms of planning. Often what happens is that this is not looked at as far as planning is concerned. And when you're looking at planning in terms of starting a hospital, then when you're looking at other factors, e-waste management and e-waste sustainability in terms of management should also be part of your planning. Some of that is not done. The focus is on other aspects. So I think that is something which should be done.
Thank you. Thank you so much, sir. The next question is for Dr. Bajaj. What are the first 3 steps a small or mid-sized hospital can take today to start moving towards circularity without large capital investment?
Yeah, for a small hospital, I think capital investments are something that we are always worried about. We often think that sustainability requires big budgets, but I think the first steps are actually very doable. The overarching principle of reduce, reuse, recycle works everywhere, not just in general waste, but also in e-waste. But I think we should first start by, as Dr. Karan Thakur had also said in his opening talk, that we audit and segregate waste at source. Actually, we should understand how much are we generating. We should separate the e-waste from the biomedical waste, from the recyclables, from the general waste, to make sure we understand how much we are producing. And this requires more of training than any money or any budget. This just requires training. Then second, as we said, recycle, we should make sure that we partner with only authorized recyclers, and like Karo Sambhav is already here, if we can educate our hospitals to understand that these are the people who are actually certified, they are doing a good job, and they are actually offering a very low cost or maybe even a revenue sharing model where it is revenue positive for you rather than an expense for you. And then reduce, I think, is most important. Extend the life of the equipment, focus on preventing maintenance, refurbishing and repairs before replacement to cut waste and cut costs. So I think sustainability is not about starting big, it is about starting now with the resources you already have. And human resources, I think, are the most important.
Thank you, Dr. Bajaj. The next question is for Mr. Pranshu. What are some low-cost or no-cost strategies hospitals can adopt to start embedding circular economy principles into their operations? And also, if you could share examples where circularity in healthcare has led to measurable cost savings as well as the environmental benefits.
So on the cost saving sides, I don't think there are many examples because circularity is relatively, deep implementation has just started. Very few, like Dr. Karan mentioned about a very holistic approach. There are very few organizations where we see that sort of a very holistic approach, and numbers are not easily available. So very difficult for me to comment on, what are the cost savings. But again, I think if we were to convert all the impact into health-related outcomes or health-related benefits, I think that would be huge. Again, I have no numbers with me at this point in time. So for me, and like I said, for me, hospitals can play one of the biggest role in driving the action from a producer point of view, because everyone is listening to their customers. And when I talk to organizations across the country, I see a huge level of resistance because everyone assumes, is my customer going to demand for this? Are they willing to pay extra? In many cases, they are not even extra costs of manufacturing a product which is significantly better from an environmental perspective. Has lower carbon footprint, has lower toxicity potential, which means it has very little materials of concern. But because there is no pressure from a customer, in this case hospitals, a lot of organizations keep on deferring the whole idea of putting good practices in place. For me, I think, and Dr. Karan also mentioned this power of aggregation. I think that is the first level of aggregation that would be a huge, huge force. If there is a common standard that most organizations are adhering to, that, okay, this is how I'm going to procure my electronics, this is, and in many cases, for small hospitals or even for mid-level hospitals, it's a nightmare to even figure out recycling kaise ho rahi hai, sahi ho rahi hai, nahi ho rahi hai. What are you looking at? You are looking at just a certificate issued by a enforcement body. Now, us certificate ke, is that certificate really standing up to what it means? Are the recyclers truly doing? Because, there are also cases when recyclers have not really done the best quality job. So it becomes a very, very challenging job for, whether it is hospital or any other institutions to manage that whole thing. First of all, select a recycler that may ensure that the recycler is truly doing the best job. So at aggregated levels, I think, the power of force would allow these things to happen. So my first request, for everyone to consider is to come up with maybe, and it could be just these three group of hospitals who are sitting here, with some set of simple common guidelines that, okay, this is what we should be talking about. It's a completely no-cost initiative, put certain things in perspective, certain baseline principles of circular economy that design precedes recycling. So, can we start talking about that? And then, some basic common checks. I think that's the way to go. And as we have more and more data, as we have more and more understanding of the subject, as well as the clients of hospitals, which are patients, how do we encourage them to adopt some of these things? I think one can really start from here, because as I said, trust is a critical factor, and most of the people do not trust all the messages which are floating around, in other spaces. But if something comes from hospital community, I think it will carry a lot more weight.
I absolutely agree, Mr. Pranshu. The next question is for Dr. Thakur. What role do you see private sector, public sector collaborations playing in building nationwide e-waste solutions for healthcare? Over to you, Doctor.
Thank you. I think, PPPs are much acclaimed and much derided in equal measure of working and not working. But I think this is a national crisis of waste and e-waste and, other types of waste that is being generated, hazardous, non-hazardous, through the health system. And COVID is a wake-up call that, this needs a nationwide approach. And the health sector, unfortunately, alone cannot do anything. There is a pollution control board which really controls the architecture and regulation of how this waste is then treated. So as Dr. Pranshu mentioned, I can make sure I've segregated my waste. I can make sure that there is, as Dr. Shuchin mentioned, an aware workforce, and then I give it to a recycler or a person who is disposing this waste, a waste handler, and then realize that he or she has not done what was mandated for them to do. Very difficult for us to go and check that every bag that we have scanned out of our system or every e-waste that has been generated is actually being disposed of in the manner possible. So we need the stakeholder on the other side also to come to us. Third is some of the reforms that we require, even right from awareness to reforms, we need the public health sector also to be involved in this, whether it is at the regulatory level and also at the level of partnerships. So I think that is a reason why PPPs become very important in this, at least to develop a common understanding. Third is, like you mentioned, for 100-bed hospitals, a lot of the learning that the public health system can give at the district level, at the sub-district, and the community health level is very useful for, a 100-bed hospital or a nursing home, because they are akin to what, the kind of delivery looks like there. So can there be learnings that can cross-pollinate from the public health system into and frugal healthcare into the private health system, and also vice versa. So that's the other area where I think where we can commonly work together on. And the nationwide e-waste solution, I think requires good knowledge resources to come out. And I think that's where Dr. Pranshu mentioned that some certain guidelines of good use, appropriate use, we all could probably workshop this together and issue guidance to people who want to start, and what should they look at in terms of first steps, and also some guidance on how to take this forward in a programmatic approach. So I don't think only the health sector can solve this, and therefore the need for partnerships and public-private partnerships.
We absolutely agree, Dr. Thakur. It's a shared responsibility of each stakeholder. Now the next question is for Dr. Bajaj. How do you see patient and community awareness influencing hospital sustainability programs?
See, anything that we do, patient and community awareness is always a force multiplier in whatever you do. When you know that, when your community knows that the hospital is committed to sustainability, first of all, it builds trust a lot, right? People and patients see us as caring for their environment as much as their health, that we are trying to prevent disease. It changes behavior also. Families and visitors comply better, with waste segregation, energy saving, recycling guidelines. If you say we are committed to, if the patient sees clearly that you are using glass bottles and not plastic bottles, then your word carries more weight when you tell them switch off the ACs when not necessary, switch off the lights when not necessary, right? Helps you save a lot of cost as well when the patient sees you as fully sustainable. You see in hotels, if you go now, you have a notification everywhere that if you want to reuse your towels, please hang them up. If they are using plastics everywhere, plastic bottles, plastic toothbrushes everywhere, then you don't take those statements seriously, right? You think that they're just trying to save their laundry cost, right? But if they have everything integrated into it, then you really feel that, they are trying to do it for the environment, and you will also work with them. And then finally, of course, it creates a lot of advocacy, right? Because if everyone is together, then communities push for policies, for partnerships, for funding. So when community really cares about this, then sustainability stops being a hospital project. Then it becomes a shared movement. And we all know that shared movements are much more powerful and have a much higher chance of success than if you just try to drive a project from the corporate and push it down into one of your hospitals, and they'll all say, oh, one more project has come in, why should we do it? We already have so much pressure, so many things to do. But if you do it ground up and drive it as a community driven movement, it always has a much higher chance of success.
Thank you so much, Dr. Bajaj. And the next question, before we call it a day, I'll take 2 more questions. This one is for Mr. Pranshu. How can smaller hospitals leverage partnerships with recyclers or tech companies to overcome infrastructure gap?
So haven't worked, very closely with very small hospitals in India as of now. So I'll build on some experiences from, from other countries where I have worked with certain hospital chains. So what we have found is, in most cases, small hospitals take at least, outside India, they have been taking a lease-based model, for equipments. So, which essentially means that, or they get into a service, mostly a lease-based model, which in some way brings the manufacturer in focus, and they are responsible for then pickup of the products that are getting generated. I'm not talking of small equipments, I'm talking of large medical devices here. Those are very common as a learning, that is what we have seen. I don't know much about the Indian hospital sector, especially the small chains, but that has been a very common thing. Another thing that we have seen, and again I don't have enough data from India, but I've seen a lot of dumping. So what Dr. Karan was referring to, in name of reusing, what we have seen that a lot of products which have no utilization possibilities are getting dumped into countries, and small hospitals get tricked many a times to, I've seen this in a few cases in Africa. They get tricked into these very wrongdoings. They assume that the product is good, but then it doesn't deliver. It doesn't. It has just been sold because it just doesn't function for some other country. So one has to be a bit careful. How to be. While I would encourage circularity thinking, how do you also ensure there is a fine line between patient care versus circularity in action? So how do we make sure? And sometimes there are those tiny traps where one can get kicked. So for me, as I said, a very important thing is building community participation. So talking to patients who are coming, encouraging them to recycle, making sure whatever equipment they have, they find a proper recycler. And if they don't have a direct access to a recycler, talk to the equipment seller, because in a country like ours, we today have regulations which mandate producers to create collection channels. So ideally, any manufacturer which has sold you a product should have a buyback system for you, or should have a solution that they should have created for you. So it's a right today, because we have extended producer responsibility systems implemented in India. So you can really rightfully ask your brands that, what do I do with my waste? And I need to have a clean answer. In many cases, people will say, okay, just give it to this and that organization, and you'll get a paper which is signed, and it says, okay, certificate of recycling. So I would say go a bit deeper. Even if you don't have time, at least ask a few more questions, because that starts putting the right dialogue in place.
Thank you so much, Mr. Pranshu. And before we call it a day, the last question is for Dr. Karan. How we can ensure that the environment sustainability goals translate into action at the department and board level in hospitals?
I think this is the most important point, that Dr. Shuchin also laid some emphasis on this, on awareness. But more importantly, along with this awareness, which is holistic, which is the first step, I think we have to make, one, we have to appreciate that the healthcare worker is under a lot of stress just by the normal work that they do. I mean, just the delivery of care is stressful enough. Number two, especially in corporate hospitals, there is an initiative fatigue, one more thing dumped onto me. That is the second thing we have to be mindful of. How can we dovetail this into existing protocols, existing practices, without actually having to quote unquote burden them with this. And third and most important is any target or understanding or awareness building that is done should be relevant to that stakeholder. I mean, we talk about low hanging fruit, but who is the fruit picker? I have to make something which is relevant to the nurse. I have to make something which is relevant to the janitor. I have to do something which is relevant to the doctor, rather than having a one-size-fits-all approach on waste management, on circularity, and so on. Tell the nurse that, every time you use this equipment, make sure that you minimize the consumption of this consumable, say for example. Or every time you ask housekeeping staff, say, can we make sure that we don't overuse the dilution that is recommended for this chemical or whatever other product may be, and similar for doctors and other things. So I think that appreciation is required. And lastly, I think another important thing is sustainability should not be used as a step for cost cutting. That sometimes then managerial controls are put in a way that, for sustainability and green practices, we will not issue you this or we will not issue you that. We should not get into that type of thinking. As Dr. Pranshu said, patient care and outcomes are the reason why we exist in healthcare. Everything else has to work around it. So it should not be used as a tool to stop resources from being made available, but at the same time make sure that our workforce has relevant information and awareness so that they can action this on a day-to-day basis.
Thank you, Dr. Thakur. What a rich discussion this has been. Thank you to all our speakers for sharing not just the challenges but the pathways forward. We have heard today that sustainability in healthcare starts with awareness, but it succeeds with action. Through design thinking, circular system, partnerships, and strong policy alignment. This journey doesn't end here. Ujala Cygnus is committed to taking this forward through working groups, toolkits, and pilot programs that can be adapted by hospitals across the country. On behalf of the entire organizing team, I thank our guest of honor, our expert speakers, and all of you for joining us. Let's keep the conversation alive, because the future of healthcare is not just about saving lives today, but protecting health for generations to come. Thank you, everyone. Thank you, and see you at our next initiative. Big thanks to all our speakers. Thank you so much for joining and devoting your time.
Thank you.